Great. Good evening, everyone, and welcome to the November 2nd workshop for the school committee and guests here. We're going to start tonight with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I will quickly just read the mission statement for the Danvers Public Schools, which is the Danvers Public Schools is a dynamic community of independent learners dedicated to respect, responsibility, creativity, and the pursuit of academic and personal excellence. Tonight's meeting is being broadcast on Danvers Community Access Television. Is there anyone else in the audience recording the proceedings? That is a no. So we only have one agenda item tonight, so Dr. Dana, I will let you take it away, please.
Okay, thank you. If we could just take one moment. We have a
Technical
text,
issue?
well, a text from Ben. Did you have the same text?
They're just fixed the YouTube link to make it public. YouTube link had a setting. It should be good now.
So for those of you trying to watch on YouTube, there was a issue with the link which should be resolved.
Thank you. Thank you. Thank you. So for this evening, we'd just like to take a few moments, and Keith and I will set the context for the meeting as part of our work with our teachers and our employees, and looking at next steps and having the workshop format is being able to have the discussion with our Director of Public Health, Mark Kaleo, is here, and we have our Teachers Association, Kathleen Murphy, President, and Jody Sheen, the Vice President, and we also have from our Administrative Assistants Association Union, we have Kathy Spinelli, and from our Teacher Aides Union, we have Kathy Johnson as presidents of their associations also. So we have been meeting on we meet with our DTA on a weekly basis, and with all of the heads of our unions on a monthly basis for a joint labor management on health and safety, so that has continued. What has happened since, if we look at the work in reopening schools, we came to school committee on August 6th with a reopening plan that school committee voted on, and then on August 19th, the state came out with a color-coded metrics and looking at the yellow and the red and the green and the gray area. And from there, we then went into opening schools and having an MOA with our Teachers Association. And here we are on November 2nd, and in the last week, as Danvers, the colors moved to yellow, and then last Thursday moving to the red. At the state level, some changes there in working with the Department of Public Health through the Governor's Office, and then with our Commissioner of Education. There's a major piece that is asking school districts to monitor 3 weeks of reports before making any changes. And in addition, for districts and schools currently open for in-person instruction are encouraged to remain open even if their local community is designated as red, so long as there is no evidence of COVID-19 transmission in the schools. So as part of that work, with the school committee coming here this evening to have a workshop to be able to talk with Mark Kaleo, be able to ask questions back and forth with our leadership from our unions, along with central office and school committee, and hoping that then school committee would have a vote by the end of our workshop, and looking at where you would like for the school district to go in representing the community. So at this time, I'd like Keith to take a look at what resources that we gave. There's some information in here, and then we'll bring it back to the school committee to open it up for the workshop.
Great.
So a lot of the information provided in the packet is just for your reference. It's background information. So the first page is that information that Lisa read the excerpt from. This is the communication that came directly to superintendents, charter school leaders, and other district officials. On the second page is just an article that was just a frame of reference as we looked that at least one of the news outlets identified as high-risk communities. It's not information that I've necessarily seen from the Department of Public Health, but more anecdotal, that where it seems to be moving with positivity rates over 10%. So again, just the background information. The next 2 pages are charts of the cases reported inside school settings. The first one is from 10/28, the second one is from 10/21. I'll say that you'll see that the district reported 1 case in the 10/21, and then it shows up as 0 cases, 3 cases in the 10/21, 3 cases, 0 cases in the 10/28 report. I will say that we did report 1 case that week to the Department of Elementary and Secondary Education, and it involved a student who was on the premises of the school but was not inside the school building, and they deemed that to be different even though it was a school-sanctioned activity. So as we learned about how DESE reports out or does not, that was one of our, learning curves with them as we worked through it. The next page is kind of an evolution of how the dashboard has evolved. So the top part is, as of 8/11, is how the metric worked, and this was a graphic put out by DESE that showed if you're in the red, the expected learning model was remote. And then on 10/22 is when they updated those weekly reports to identify the cases in long-term care facilities, prisons, and college settings that equaled 10 cases or more than 30% of the total cases to show those clusters. And then as of 10/27 is that language that Lisa read about guidance for schools about what being in red means. The next page is a chart that we keep internally within our office, so part of the MOU with the teachers union, and we'll get to that later on in this packet, talks about what communities our teachers and our staff are coming from. So this is color-coded based on the state metrics showing what color codes that each of the communities are where our staff lives. You'll see, as with the state of Massachusetts, we've really seen an increase over the past few weeks as many more communities have been entering the red. The next pages are 2 decision matrix and different metrics that Hamilton Wenham uses in their evaluation of whether to have in-school education or remote education and the transitions between. So it shows both directions of how you go from green into the red and then red back into the green. The following page is a similar thing that is put by Gloucester. You'll see about 2/3 of the way down the page are the metrics that they use for helping to determine what the spread is within their school setting. And thank you to Mark for helping provide some of that information based on his peers. The next is a page out of our temporary contract agreements with the Danvers Teachers Association, which really we negotiated directly with them. It was representative of all of the unions of working with them over the summer to answer all of the questions. You'll see the first part is kind of why we're here tonight in the first bullet that talks about having collaborative information sharing between all parties. So that's part of this process and having a workshop. And then the second bullet talks about that community spread from where teachers and staff are living, and if that was to exceed 25%, that would trigger us towards moving towards remote learning. And the idea behind that was, with the data at the time, was making sure that if COVID was spreading in our surrounding communities, that they were not going to be transmitting it into the Danvers setting to help control it. And again, these were all done in, I would say back in probably August, I think is when we came to our contractual settlement with them, based on the information we had then about what the colored metrics meant from the state level, which we've seen evolve quickly. And then the last page is really just kind of a notes page that I took from the packet, just highlighting different pieces, from the news article of a positivity rate above 10% to the stoplight based on the local data in the actual schools themselves, stoplighting that data, which you'll see in especially the Gloucester example, is what direction those are trending. And then I think a secondary conversation to in-person or remote schools is what do we want to do with athletics.
Last week, you and Steve Bartha put out an email based on the old information, and then shortly after, all of this new information came out, new guidance from DESE. So I think there's a lot of confusion out there, which is why we wanted to hold this workshop to kind of figure out what our plans are and have, like these other districts, kind of multiple plans, A, B, and C, in order to have a clearer understanding based on the current guidance, knowing that the current guidance can change, as we've seen it change over time, as we move forward.
Yes.
So unless anyone has a different thought, I'd love to hear more from Mark about, where we are in Danvers and, how things look and all of that.
Sure. Of course, first, if I could start with just a thank you to Lisa and Keith for the invite. We're always happy to participate in these discussions. So for anybody who doesn't know me, I'm Mark Carleo. I'm the Public Health Director for the town. So where we're at currently, our last reporting period, we had 25 active cases in town. That was as of last Friday. We have none in any of our long-term care facilities, and we've not had any school-based transmission either. These are all out in the community at large. Anecdotally, from our public health nurse interviewing these cases, it's social and family gatherings. And it was hockey until that was put on pause by the Commonwealth. That's pretty much the broadest overview that I can kind of provide of the cases that we're seeing currently. Other than that, I think, I would just add, sort of as a reminder as these discussions go on, that, one thing to keep in mind is that right now, there is no such thing as no risk. And the discussion should just be about what level of risk are we willing to accept and how much can we mitigate. Thank you.
Great. Thank you very much, Mark. Since this is a different format from what we do normally at a meeting, I guess I'll start with the school committee. Do you have any questions for Mark? Eric?
Yeah, okay, so if I heard you right, 25 cases currently?
Active, yes. That means people that are sick and in isolation.
Okay, and so anyone who's already had COVID and come through it wouldn't show up in that number? Okay.
No, because we've had, since the beginning, 800 plus cases.
And my recollection is that right around the August timeframe, when we were talking about what education process we would use, the active cases then were in the single digits, right? Seemed like 3, 4
Yeah.
sometimes. Yeah.
Yes, sometimes one.
Yeah.
It was a great time, yes.
When did it start to tick up in this considerable way?
I want to say, considerably, 3 to 4 weeks ago, I believe. We started to see it about a month ago. I believe we were still in single digits a month ago. Please don't quote me on that. but,
Sure, of course.
Timelines since March in our field
Yeah.
are blurred. It very quickly went from single digits to high teens, and then jumped right mid-20s, and that's just where we've been. It happened pretty rapidly.
And I think you talked about the fact that it was primarily from social gatherings, you think?
And family, yes.
And was there one particular event? Were there just multiple events? Because you all hear about the super spreader events.
Yeah, I don't think we've actually, I think they've happened, but we didn't actually see the spreading occur, or so that it was at least a potential super spreader event. But no, our cases are coming in, 2 to 3 at a time. Family members, a husband and a wife, or a son and a father. It's looking more like that when it comes to the family gatherings. Otherwise, it's friends in social settings.
Okay.
And it's the same principles that we've been pushing since the beginning that just aren't being followed. The distancing and wearing your masks.
And how have the contact tracing efforts been? Have you had success getting people to call you back, getting people to cooperate?
Our public health nurse, Judith Ryan, is tenacious.
Good,
And
that's a good
she will expend a lot of effort pursuing an individual case, tracking down their contacts, and then contacting every single one of the contacts.
Okay.
She will make numerous attempts before she will ever call this one lost to follow-up. She'll try different avenues to reach them, almost whatever it takes, short of knocking on their door, I think.
Okay. And the hockey is interesting because that's showing up. Fitchburg, I think, had an issue with a major spreader from a church and I think also from a hockey. Are these adult leagues that you're talking about, or youth hockey, or?
So the Fitchburg thing, I don't have the details on, but one of their health department staff sent me a text, asked me to call, so she could kind of give me the rundown. But as far as the hockey goes, it's the players, I mean, it's close contact. I'm not exactly sure, I can't tell you why we were seeing it in hockey. There's conjecture, I guess you could call it, about the temperature and humidity that they play in and how somehow it travels differently. I couldn't tell you for sure. I don't think that that's exactly settled.
Sure.
But all we can say is hockey, for whatever reason, we were seeing transmission there.
And is this, the ones that we're seeing contributing to our community, adult leagues, youth leagues, both?
I believe it was youth leagues. A lot of it had to do with playing games out of state as well, in New Hampshire.
Okay. All right, that's all I have for the moment, Mr. Chairman.
Great. Jeff?
Great. Yeah, I was going to ask about the hockey as well. So to be clear, this is youth hockey only. There's no evidence of adult hockey league participation spread.
I don't know off the top of my head if we have adult hockey players in Danvers that have contracted COVID, but I can't tell you for sure.
Okay, but it wouldn't have been them yet. Okay, and then yeah, I mean that's interesting for youth leagues because we do have the other youth sports
Yep.
as well. So
It's shown up in other sports, but primarily it was, especially early on for this kind of second round, I guess we could call it was hockey. Perhaps it was just the season.
Well, it's indoors too, right? It's
Yep.
close contact, and
Yep.
so I could understand that. Okay. Question, so 25, what was it last week?
I don't remember off the top of my head. I want to say it was something like 17 or so.
Okay, so 17, 25, so in no case it was 35, because I saw a number of 35.
So 35 was not the active cases. 35 was how many cases were in that 14-day window
Okay.
where the measurement is taken for the average daily incidence rate. It's a 14-day average. So when they determine what color you are, it's a sample of 14 days. So that the 35 came from those 14 days. So those 35 cases, that's the reason that we hit red.
Okay, because we're only at 20, so I'm trying to do the math. So if we had 17 and then 25 this week, you're saying that at some point, 17 people were active and an additional 18 out of that 25 would have to have been infected at the same time. And then, so how do you get to 35 over 2 weeks if 17 is 1 week and 25 is another week?
I can't tell you for sure. 17 is what I'm recalling from the
Yeah.
week prior. I couldn't tell you for certain. I'd have to look back at how I updated the website. So I'll just try and explain this again. So there is, what the state uses to determine your color code is it uses a 14-day window. When you have COVID, you're sick for, on average, typically 10 days. So there will be cases falling off in that 14-day window. So we're posting active cases are this, but the state is using this 14-day average, and that determines your color. Essentially what I'm saying is one has almost nothing to do with the other.
Yeah.
There's some overlap, but that's about it. So we use the active case number on the website just to help people understand how much is actually going on in the community. The other calculations that are done by DPH are more for decision-making, like, when do you close schools?
Okay, all right, because the overlap is what I was concerned about, because if you do the math, 25, out of 100, if it were that many, would only be like 6.25 out of 100,000 for Danvers. But if it's 35, that's when we went to 8.8, is that?
Yes,
All right, and so red is triggered at 8,
above 8.
above 8. And when will the next red, yellow, green come out for us? What day this week?
They just changed it, but Thursdays, it comes out Thursday, I want to say at 4 o'clock.
Okay,
Yep.
all right, so we'll see that again as well.
Yeah, I'm doing my own calculations daily to kind of see where we're tracking. We moved down a little bit since the last reporting period. So it'd be nice to see if it stayed in that direction, but that's not predictable.
Okay. And this might be a question for you or maybe for somebody else. So I see Beverly has gone to red, Peabody has gone to red. If I remember looking at the data for Beverly, they really went up, like to 15 point something, I believe. Is that, do we know that? Is that correct? Since that's the second largest area where teachers live.
I was scrolling through today, through the state data, and kind of happened to glance at Beverly, and yeah, it looked like they had made quite a good-sized jump. I'm not sure what's, leading into that. I have a Zoom with all the North Shore Health Directors, including Beverly, on Wednesday, and looking forward to hearing what is going on in Beverly. But right now, I couldn't really tell you what's contributing.
Yeah, because my initial view is just where I'm kind of going with this is, if, we're going, 17, 25, and somehow it levels off and gets down and is at a certain level, and we're at 8.8 and the threshold is 8, I can say, okay, look, maybe we're, turning the, something is doing okay, right? Where we're leveling off and it's fine. But if surrounding communities are going to 15, 20, then I would have more of a concern, I would say, about potential spread here. Is that the right way you would think about this from a public health standpoint? Or no, really, these communities are so different and you wouldn't consider looking at surrounding areas for a possible view of where we would be headed?
I think it's worth keeping an eye on everything that's going around. As it's been said plenty of times, viruses don't recognize geographic boundaries or political ones. I'm curious what's going on in Beverly. Perhaps it could have some sort of an impact on us. Not necessarily, because you can look and see that there are other communities that we border that are not red or yellow. I think Wenham is still gray. So I couldn't really tell you. I mean, there are some similarities between Danvers and Beverly, but demographically, I don't think so much. Housing density is a little more so, I think, in Beverly. So I wouldn't necessarily use Beverly as a predictor of what would happen in Danvers.
Okay, good, thank you. Those are my questions, thank you.
You're welcome.
Great. Mary Beth?
Well, Beverly may be going up because of the college. My son attends Endicott, and he just got an email today that after Thanksgiving, they're going to be remote till the end of the semester. And I know that the college numbers have gone up because they test weekly, so that could be one of the spreaders as to why you're seeing an increase in numbers there. Just one of the thoughts. But as far as Danvers goes, numbers in Danvers for in the school are like the 1 or the 2, correct?
I think the 1 was even revoked. They didn't really count it. But yeah, we're not, so the way that I would express it is that we are not seeing COVID transmission in the school setting. Whether it's in a classroom or the cafeteria, it's, we're not seeing it.
And what information do you have regarding children and COVID? Any new information that, are they, because I keep seeing, the governor's saying they're not spreaders, which, either that's true, because in Danvers we're not seeing the numbers or we're doing what we're supposed to be doing here. But is there any additional information that has come out to, for evidence to that?
So as far as whether children are spreading it or not, that one makes me want to just put my head on my desk, honestly, because nobody seems to be able to make a call on that one. In terms of the actual illnesses, it seems as though it's generally not severe. There are, of course, cases where there are severe illnesses, hospitalizations, and even deaths. So it's not, again, it's not to say that there is no risk. There is. It's just tough to calculate. That's pretty much it. There really hasn't been a whole lot of news about children other than, in general, it's transmission in the schools can be low if you have good policies and they're following it.
That's it at the moment. Thank you.
Thanks.
Arthur?
Just a couple of general kind of big picture questions based upon what I'm hearing, and you can tell me if what I'm hearing is right or what you can tell me about it. Listening to the governor in the administration over the past week would indicate to me that the vast majority of the cases are just what you said in Danvers, which are kind of more local, a family gathering, friends gathering, situations like that.
Yes.
And they're not really coming out of A, schools, B, restaurants, C, places where people are following the rules. And they seem to be more in places where people would be more likely to have their guard down, where they're just kind of socializing, doing whatever. Is that kind of what, am I right when I listen to him, and is that what they're saying?
I would say, yeah, you are. If you look at the presser he did today, along with the revised orders and new orders that the governor has issued, they are aimed at social and family gatherings and causing people to wear their masks all the time. So he's directly targeting those things, because it's not just Danvers that's seeing it in the social and family settings. This is across the Commonwealth.
And the other thing that I'm taking away from what I've heard the last week or so is that, and we know this anyway, but the knowledge is always evolving and getting better. And what we know, what we seem to know now that we didn't know in August, and what we certainly didn't know in July and June, is we can now kind of track where these cases are coming from. So we now know better what the cause of the cases are, just like we just said. So we didn't know it, or we couldn't track them to social gatherings in July, but we can now. We couldn't say what was coming from where, correct?
In some cases, we had so many cases at one point that really expending that extra effort to really try and, dig in and find out where these cases were being transmitted was tough, especially earlier, in the spring and early summer when it was just outrageous how many cases.
Right, we hadn't done, contact tracing was really not up and running greatly at that point in time, and that stuff has all evolved over time, so again, we're learning more and more about.
Yeah, absolutely.
All right, that's all. I just had a couple. I just wanted to kind of see if I was on the right track with those things.
Yep.
So if I could just jump in real quick, if we could just ask everybody to speak into the microphone. We're just hearing some complaints from home that it's hard to hear people.
So bring your mics in and speak loudly through your mask.
Thank you.
Mary Beth, you had a follow-up?
Yep, just a question. So I saw last week, I think in the news, that the federal government was sending tests to the state of Massachusetts, rapid tests for schools. Do you know any information on that?
I mean, I know that the state has plans to be able to respond to schools that need testing on a scale very quickly. I'm not really familiar with the details of it, other than how we can kind of try and access it.
All right, so that would be if there was an outbreak in a school district, that what those tests would be for?
I'm not sure.
Okay.
Nope.
So I can fill in a little bit
Yeah.
there. So we did sign up as a pilot program. That is one of the it's a nostril-based test that gives results in 15 minutes. It is meant for symptomatic students and staff within the school setting. So it's kind of two programs. There's a rapid response program that DESE has if we were to sense an outbreak that was occurring in the school setting. This pilot program that's coming from the federal government is for testing on site at the school for people that are symptomatic. And it was a pilot program that there was a survey that closed on the 30th that we signed up for one of the districts that was willing to pilot it. And now it's just kind of waiting to see who DESE chooses to pilot that with. And it would be administered by our school-based nurses
Okay, thank
in
you.
the school.
Thanks.
I
Thank
have
you,
a
Dave.
couple more, Mr. Chairman.
Okay, and then I want to get to our guests, so go
You
ahead.
want to go first, or you want?
No, I want to get to our guests, but you go ahead.
Oh, okay. So of the 25 active cases, can you tell us how they break down in terms of age group? And, we can divide it by, say, 0 to age 11, 12 to 20, and then above 20.
So I don't have the age data in front of me. We do have that breakdown done, and it's not in the exact, it's so that we can kind of see about school-age kids
Yeah.
and if the transmission's occurring there.
Yeah.
And that's not really where we're seeing it. It was 30s and 40s.
Okay.
That is on the website. I'm sorry to interrupt. I did see it on the website today.
Yes, that's right,
it's-
yeah.
It's very
That should have been
detailed.
posted today, yes.
Okay. And when we talk about, and I've heard this not only about Danvers, but about other school systems, no transmissions within the school. is that based on contact tracing in essence? Because, and that's how we're saying, well, they got it someplace other than the school.
So if, say we interview, let's call it patient 0, and patient 0 says, okay, I had symptoms, I was in my classroom on this day, and we would then go to this, say, go to the school, and then in the classroom, there's this many kids that are identified as close contacts, and then you start having them tested. When they start coming back positive, it probably came from patient 0. That would be school-based transmission.
Okay. Thank you, Mr. Chairman.
Sure. Kathleen, any questions for Mark?
I don't have any questions for Mark.
Okay. Jody?
So the one question that I did have was, I felt that early on in the discussions around school opening, they talked about the success for schools staying opened would be keeping community spread low. Is that correct?
Can you restate that? I'm just, I
Sure.
want to make sure I understand.
Sorry. I feel like when the conversations first started with school reopening plans, they talked a lot about the importance of community spread staying low in order to keep cases out of the schools, because that was the key if you didn't have the students who were asymptomatic coming into the classrooms. So I guess I was just wondering if you had any information on that or any concern with, as cases rise or if they continue to rise in Danvers, could that potentially come into the schools?
I mean, if the parent of a child is COVID positive and the child is exposed, and they could potentially, asymptomatic or even symptomatic wind up in the school building, that's absolutely a possibility, yes. How that relates to how many cases are out there, we're not really sure. And that's where that whole kind of color-coded map idea sort of came from.
Anything else, Jody?
No, I think I'm good for now.
Okay, great. Kathy?
I'm all set.
Okay. Cindy?
Kathy.
Oh, Kathy, I'm sorry. I can't read from here.
No questions, thank you.
Okay, great. Mark, my question, I guess, was just about, us being in red right now, and you indicated you thought the numbers might be ticking down a little bit. I know, any indication as to whether will be in red during this next reading because it's part of the 14-day period, or could we potentially fall back into yellow?
Yeah, I mean, I wouldn't try to predict the future, of course.
No.
I would expect that we're going to stay in red this coming week. It would be great if we drop down to yellow.
Of course, yeah. But
So
based on those numbers
the number that
and
I
what you've had
calculated
coming
today
in.
is a tiny, tiny bit less. It's not enough to get us back into the yellow, and it doesn't represent a trend either. It
Sure.
just was a little glimmer of hope in my day. So we'll see. It really depends on the community. It's this school and every student in it requires the support of every single person in this community to wear their mask, to distance, to stay home. These are the things that are required, to stay home when you're sick, especially, to get tested when you don't feel well. Those are the things that are going to make discussions like this almost unnecessary.
Mhm. Okay, great, thank you.
You're welcome.
Anything from the administration?
Heath is our COVID liaison, so works closely with Judith and with Mark and other town departments, so we've had ongoing conversations.
Right,
Actually, Dave, could I ask one more quick question?
of course.
I think one of our school committee meetings, when we had talked earlier, the average time to get a test result back, I don't remember what it was. Was it a week or two? It was to something like that.
Oh, yeah, there was a
What
period there.
what is it now? Is it quicker now? Like if someone is symptomatic?
It is quicker, yeah. So
Okay.
it's, I don't know what was going on there, but it was, 7-8 days
Right,
sometimes. So it does depend on which test. It depends on which provider is doing the test.
Yep.
If you go to one of the state's Stop the Spread sites, 2-day turnaround.
Great, okay.
There are the rapid tests too, but those, if you're not symptomatic, don't bother.
Yep. Good feedback, great, thank you.
Yeah. And I would say I have seen those numbers go way down. I get tested once a week, and I get my results back in 24 hours, roughly 24 to 30 hours, I would say.
Yeah, they always tell you 2 days, 4 days, something like that, but yes, a lot of the time you
Usually
do
they're
actually
quicker.
get it back in a day.
Right.
Good.
Do you get tested once a week because you're the chairman?
Yes. No, job requirement. Okay, so one of the main reason for having this meeting is because of all of the changing information. You know, when we first started school, our thought process was, once we go red for a certain period of time, then we're going to go remote. Now the guidance from DESE is that even if you go red for, I think it's 3 weeks or longer, you don't automatically go remote. It's depending on what the level of spread is, or if there's any activity within a specific school. And I think even in that case, if there's a hotspot in a particular school, that decision probably gets made by grade, by school, not necessarily that the whole district goes all in or all out. There's some flexibility there. Is that accurate based on
Yes.
visitors?
We're just gonna check for 1 second.
Okay.
There was a meeting that was moved from this area, so we'll just do a,
All right, quick break here.
all right. So Mr. Thompson, I'd ask you to just restate the
Okay.
question again. as we're trying to
Absolutely.
listen here.
So my understanding is that we need to discuss whether or not we want to stick with the original plan that we had based on the guidance back in August, I guess it was, to if we hit, I think it was 2 weeks of red, that we would go remote, versus the new guidance that just came out the end of last week, that just going red for a certain period of time does not necessarily change your model of school. It is more dependent on whether you have a cluster of activity within a school, and then if it's within a school, the determination is made, is it a class, is it a grade, is it the whole school, not necessarily the whole district.
Yes.
Is that, am I framing that properly?
Yes, thank you very much.
Okay.
So from back in August, things have evolved with, in speaking again with Mark Kaleo, and then what we're seeing, the governor spoke today, superintendents, we had a call with the commissioner today also, so that is evolving, and we know more than we did back in August.
Okay. So I'm going to open it back up to the school committee for your thoughts on, you know, do we stick with what we had in mind based on the information we had in August, or do we change our thought process based on the new information that has come up over the last several months, and then, or several weeks, I should say, and then conveyed to us or to the whole Commonwealth at the end of last week? Jeff, you want to weigh in on that?
Sure. So when we made that determination, was that a vote that we had, and then that was, we were giving power to the superintendent to make that call based on the data that was available? Or were we going to see the data, this is what we would have, and then we would come back for a vote to determine whether or not to go full remote? Which was it?
So I'd say there were multiple parts to that, and all of us going through this for the first time, so we're trying to use processes that we've had in the past and use them during a pandemic. So the commissioner changed along the way, then having school committees approve the plan. So that was back in August, approving the learning model plans. And then from there, to go back and do the impact bargaining with our associations, and in doing that, and then it came back to school committee as part of that. So the meeting we had back in September would have been voting on the MOA. So there's multiple parts to this. As part of that, we did say that part of it would, in being going forward, would be to have a discussion, have public health, have our unions, have our school committee and administration together to have this conversation as to the next steps. And really, a major part of it is as we've been in school since September 16th, and seeing what has actually been happening, and the transmission is not in the schools, as Marcus said too, the mitigation strategies that have been put in place when we're using them in the hybrid model, we're not seeing it spread through our schools. So that brings us here today with then the state looking at least 3 weeks of data, and if you're in person like we are with our hybrid model, of requesting to stay in school.
Yeah, and I think that answers my question, because my preference is to have us as the school committee vote on this. I don't want, whatever metrics we come up with, and I see Hamilton Wenham's, and they look fine, but this is evolving, and I want to make sure we have the latest data, and quicker too, right? It might be something happens where we didn't list it on a piece of paper, and it's yellow, but there's a reason they're yellow, we would have to close. I want us to have that responsibility to discuss it, time allowing. I'm sure there might be some extenuating circumstances, but I do want us to be able, I don't want to have something on a piece of paper that says, oh, red 3 weeks in a row, that's it, you're done. Like, I don't want that, right? So I do think it is a good idea, though, to add additional data or metrics that we would strongly consider. And this is what we discussed, too, when we went and discussed hybrid versus remote. We all asked and said, well, what metrics would you look at to go to fully open? What would you look at to do fully remote? What would you consider? And each of us had to consider our own metrics, and as we talked about, the risks that are involved, because that's what this is. It's a decision tree. It's a risk model. How much are you willing to accept? And that is changing. And those risk models change every single day. And that's what we have to determine in all of this. And that's why I want all of us to be able to talk about it, think about it, because we all have different information that's coming through. So if the question today is, we are heading on a track to go fully remote unless we make a decision today, I want to make that decision so that we're not going to go fully remote with a 3 weeks worth of bread. If that's what you're asking for today, and I don't know if we're going to have a motion or however we determine that, but that I would support.
You summarize it exactly where we are
Yep.
on this Monday, getting ready for a report that would come out on Thursday. Then
I was
ask
gonna say, I would
Keith-
just
Keith
clarify
to-
that I would say the MOU right now with the teachers union says after 2 weeks of data. So not 3 as the state said, so prior to the state releasing that information and that guidance, we were in the process, and based on the incubation period at that time, the determination was to look at data in 2 week cycles, not 3.
And the definition of red was the same then as it is now.
Except the implications for red have changed. So at the time, Desi was saying, if you're red, you should go remote, and leaving it up to how many cycles of red before you go remote. Now Desi has changed and said, even if you're red, it doesn't mean you should go remote. It means you should stay in hybrid unless there's a school-based outbreak, or you see evidence of school-based spread.
Okay, all right. Well, I mean, I want to hear from, when we determine this and have this discussion, I want to hear all of the input from teachers and from everybody else, from staff, as to their viewpoints on it as well. Because as Dave said, we've received several emails from parents, particularly special needs parents, who have said what the impact has been just on hybrid, and their real concern for going to a full remote. Completely understand that, and many of those stories are heartbreaking. And so a lot of that has to be considered with, as we talked about, the overall risk for community spread. This is why we ask the questions on how fast can you get tested? Is it spreading in the schools? Are there other considerations to make everybody as safe as possible? And so that if that's where we're at, then that's what I would support.
Thank you. And may I add one other piece to that about what we've learned in this past week, and Mr. K, you said it also, of how can things continue to evolve. So I'd ask Keith to share your suggestion of a monthly workshop.
So if we are to move in the direction of not closing upon 2 cycles in red, the idea was, could we have a similar workshop to this on a monthly basis and ask Mark to come out with us and our unions to come out and to maybe meet from 6 to 7, like we are, we're not gonna necessarily end at 7 tonight, but to meet from 6 to 7 in a workshop format to hear the latest data and the latest trends before the school committee meeting that starts at 7 o'clock, and then do our regular meeting from 7 until whenever that concludes. That would just give an opportunity for that data. And then if something seems like it changed drastically in between meetings, like we did tonight, there could be a special meeting called to have everybody come together to have that discussion sooner, but to be part of that regular update and regular communication.
Yeah, I would support that 100%. And we could also provide questions ahead of time to save, any time here and make it as quick as possible. That's fine. Those are my questions. Thank you, Mr. Chairman.
Mary Beth?
So I have a comment regarding, the Commissioner of Education and the Governor. All school districts have done a lot of work with the unions, with the community, all summer long, come up with the plan, just like they asked us to, and then we're doing what we were asked or told, like, do what's right for your community, and then they come out a day after we do like an announcement, and they're like changing course, and it's great, but like give us a heads up that you're gonna do that. So I'm very frustrated with the Commissioner of Education just not giving a lot of guidance to all the school districts in the Commonwealth. That's just my rant on that. We have received numerous emails, not just several, numerous emails over the last couple weeks, especially in the last week. And they all have said the same thing. It's very important that we continue on in person, even in the hybrid model, because it's been the most important thing for their child. A lot of children are suffering, a lot of the younger children, even just the emotional part of it, and a lot of adults are suffering. I think it's very important that we try to stay full, in the plan that we're in right now, the hybrid plan, as long as possible for our youngest learners and even our older learners, and especially special education students. So looking at the metrics, having the monthly workshop, and just keeping an eye to what's going on. But I really truly believe I'm full in favor of staying in the plan that we're in currently, the hybrid plan. And hopefully at some point, the district can move to getting more in-person learning for some students, but it's gonna take a while. We're still in a pandemic, but I do appreciate all the work that everyone is doing for this, but I think as a district, it'd be very important to stay in the learning model that we're in now. That's all. Thank you.
Arthur?
So I agree substantially with what both Jeff and Mary Beth said. And I think everybody involved has been making the best decisions that they can based upon the knowledge that we have at any particular given time. The information that we have and the knowledge that we're gaining changes, obviously in this situation, considerably over time and sometimes in short notice, which makes me think that it might even be necessary to have one of these meetings every couple of weeks, not just every month. And if that's what we have to do, then I'm totally in support of that. I just want to, make sure that we do what we need to do to get this right. My overall feeling about the question, I think that was the precipitator of this, is that, the state put out the red, yellow, green, gray guidance earlier, late summer, midsummer, whenever it was, based upon what was known at that particular time. The state put out the guidance. The state is now telling us that based upon what they know, that particular guidance is no longer the guidance that should be used. So I have to rely on the creator of the guidance as to what they say the effect of the guidance is now. But what they say is it makes sense. If there's no school spread, then there's no reason to take these kids and prevent them from being in the schools. And that's especially, again, when you read the emails, which I would say I would characterize as anguish when I read these emails about the detriment to the kids if they're not in school, and that the fact that the 2 days isn't even enough, but they're okay with it for now. I don't want to say they're okay with it, they're not, but they're accepting of it. And that the kids look forward to their 2 days, and the 2 days are the most important part of the week, and the damage that happens to the kids when they're not in school is just, I mean, I'm reading it, I'm glad my kids are 20 and 24 now, because what I'm reading is really, really, really concerning me. And so, you know, we have to manage this as best we can, but I think that right now that Jeff said, you know, if we're taking a vote as to whether or not to change what we've decided, so we automatically do something, then I would agree with that, and I would vote to change. And I understand that work has to be done with the unions, and I totally get that. But I can't. There are no cases in the school. I cannot tell parents that because the red number, which the state now no longer tells us is as meaningful as it did 3 months ago, is red, that the kids can't go to a school that doesn't have any cases in it. So that's where I am on that. Again, just trying to make the best decision that we can for the kids. That's all we're here for, and that's what it seems to me to be the case right now.
Great. Thanks, Arthur. Eric?
Before we get to that specific piece.
Talking to your mic.
Oh, I'm sorry. I want to talk a little more about what we've actually seen in the schools so that the community and we are fully informed. Now, I'm aware of one case that was reported at the middle school, one case reported at the high school. There is some, and it may be confusion in the community, that there was a case reported at one of the elementary schools early on. Is that true or is that not true?
So I'd ask Keith to clarify that with us in his work with Judith Ryan also in how the data is reported, and again about being in a school setting.
Okay.
So say there's no positive cases in the school setting at any elementary school in Danvers to date. That means that the student would have, the in the school setting is determined by after a positive test or first symptoms 48 hours prior to that. So if a student is in, let's say, cohort A and attends school on Monday, Tuesday, and then tests positive for COVID on Saturday, that student would not have been in the school setting during their incubation period or during their incubation period prior to the positive test or the first symptom.
Okay. Excuse me. Are there more cases at any of the schools that fall into that school setting question you have raised? In other words, by implication, what you were saying is there could have been a student at the elementary school level following the timeline you mentioned who may have had COVID but was not considered to be in a school setting.
Correct. It would be the same. There could be a fully remote student who's had COVID and is not in the school settings. That's not something that we would report to DESE or that would get reported out to the community because it didn't affect anybody within that school community in the school setting.
Okay. Are we aware of more such cases?
I would say anecdotally I'm aware, but I would say I would not look at that information because it wouldn't affect me in my role. I would say our school nurses would have that exact data, and I know that we're tracking it in conjunction with Mark and Judith and his staff because they've been great to make sure that we're making sure the students that need to quarantine are not, but we do take that, obviously, that data and the student privacy elements that come with it very seriously, so it's not shared regularly even with school staff.
Understood. I guess my only thought would be, because we're looking at community spread, it would be good to know what's going on with the youth generally. For example, if we know that hockey is an issue, and from what Mark said, hockey has been an issue in terms of some cases, but those cases aren't showing up in the Danvers public schools, that means they could be at a different school, or we say they're not showing up here because they are taking place in the context of hockey. but the question is, does it have any impact on the schools? Are kids getting together outside of schools in ways that could increase spread and bring them in?
So and the data does get reported by Mark, so I'm just looking at the website now, and the weekly report that was for October 30th does show that there was 2 0 to 10-year-olds and 6 11 to 18-year-olds in that last cycle of data that was reported.
Okay.
So those are 8 potential kids in that last cycle that could have come to school, or, most likely are school-aged.
Okay.
That was 8 in that particular reporting period of the 25.
And that
students.
reporting period was,
This is as of October 30th, 2020, so I'm guessing that's
Okay.
from the 23rd to the 30th, or from the 22nd to the 29th.
So that's at the time of that report, the active cases, that was the age breakdown for them.
okay. And what has been going on around sports teams quarantining here and/or teams that played us quarantining? Can you give us some detail on that?
So I would say that to the credit of the public health department here in Danvers and the state epidemiologists, they have taken a more conservative approach than the MIAA may have documented as part of their process. So we have had 2 athletic teams that have had a positive case involving them, either on their team or on the opposing team. And when there's a player in a game that does test positive, the entire athletic team from both towns are being asked to quarantine for the 14 days as a close contact.
Mm-hmm. So did we have a player on one of our teams or a player on one of the teams we played?
Both.
Okay. All right. So 2 of our teams have been quarantining. Am I reading that right?
And I would say there's only, again, when we look at what information the community needs to know, we are not going to report out when a player from another town had tested positive for COVID. That's not something that we would choose to communicate to our community. We would share with those who are close contacts that they need to quarantine, but that wouldn't be information that we'd send out to the larger school community. If it was a player on one of our teams, we would look at communicating like that because it's one of our students and that affects our school setting.
Okay. And I guess the other question I have has to do with the requirements of the contract between, and I obviously want to hear the union's position on this, but in the material that you passed out to us, it says the district will complete a weekly chart for Danvers employees' residency to include as part of our decision matrix, recognizing that community spread between employees, town of residence is a factor. If 25% or more of the employees live in communities that are red, high risk, based on the color-coded map released by the governor's office, we will switch to remote. Faculty and staff will be notified prior to the community announcement. So does the union view that as an imperative, or is that, in other words, is there negotiating room around that for us? Is it a decision we can make, or is it a decision that has to be negotiated? What is the union's position on that?
I guess I would say that if school committee voted tonight to stay in session despite being red based on the change in definitions, based on that language and where the North Shore is right now in our residencies, that the school committee would need to direct administration or the negotiating committee to enter into impact bargaining with the union based on the new information being presented by DESE in the revised decision.
Okay, that's something you read the same way?
Actually, the DTA's position on this is that the clause that you just cited in red indicates that we should be following that directive and then going into bargaining. That is the standing rule, if you will. That is a legally binding document that we expect to be implemented. However, if the school committee wants to propose changes to it, the DTA will certainly consider that, and we can start looking at that and potentially bargaining that. But in the meantime, we actually have an agreement that should be followed.
Yeah, as I read it, that was kind of my concern here. All right, that's all I have for the moment, Mr. Chairman.
Okay. Kathy with a C. Any questions or comments about the discussion?
No, I think the aides are in full support of the DTA and the bargaining that they have, worked with the administration.
Okay. Kathy with a K.
This time, the administrative assistants are fully willing and able to do our jobs and reserve the right to come to the table as the situation evolves, which we all know it's going to.
Okay, great. Jody.
I think the big concern you're seeing from teachers, you asked the question, you'd like to hear from teachers. We agree with you, remote is not an ideal situation. The concern is a lot of the conversations that take place obviously involve children, but we also know schools are not just filled with children. And the latest CDC guidance that has come out too around close contacts, it's concerning, especially in the elementary level, where it's a cumulative 15 minutes and not consecutive 15 minutes. I can tell you that there is not a day that goes by in my classroom that I am not surrounded by 7 and 8-year-olds who need help. I'm behind plexiglass some of the time with them, but if they need me to come to their desk to help them, I am obviously going to go to their desk to help them. So I think the concern is also, if we do start to see this in the schools, you're going to see teachers who are going to have to quarantine. We are concerned with what mask breaks look like. You've got little kids who, 6 feet is a very abstract concept when they are outside for a mask break. When it's inclement weather, what that looks like. So there's a lot of concern around community spread and what that could mean in a school. Like Mark said, if a father tests positive and his child has it, and that child might be asymptomatic, and how that could go. So that's sort of the concern, because it is impossible to do this job from 6 feet away from a child.
Great. Kathleen?
I think that it's just, I'm going to sound repetitive, but I think it's very important to understand that the members of the DTA feel very strongly that when we made an agreement with the school committee that you ratified, that it is what it is. It's a deal. And to break that deal will cause an enormous erosion of trust amongst the teachers. That the teachers will feel as though if you're willing to break this, then what's next? What's the next thing that you're going to use some sort of, state-based guidance to violate our contract again? State-based guidance does not have the same weight as our memorandum of understanding or memorandum of agreement. It's a contract, it's not guidance. So again, we're willing to talk, we're willing to consider other options to negotiate, but in the meantime, we have an agreement and it should be honored.
Okay. The only thing I'm going to add is one of the things I think we've done very well is be consistent. Consistent with CDC guidelines, you're requiring the 6 foot in classrooms, and I completely understand that that's a challenge, especially at the younger grades. Consistent with DESE, that we followed their red, yellow, and green schematic when it was presented, and now that has changed, that guidance has changed. So I think from a consistency perspective, I think we need to follow the new guidance as well. Unless there's other discussion, does someone want to make a motion regarding this issue?
before we do that, I just want to say that I don't disagree that's why I said that the union has to be involved in
Absolutely.
discussions. So I don't have an issue with that. That absolutely needs to be done. My question is, so what's the proper way to get to that point? Is the motion to, what is the motion? Is the motion to change the contract? Is the motion to vote to open discussions? What is the motion?
I think the motion would need to be to follow, to change our policy in terms of following the DESI guidelines, and then if that motion passes, then we would instruct the administration to engage in impact bargaining with the unions that are affected.
I would disagree with that characterization only because the original motion was to approve, back in August, was to approve a plan that was presented to us, recommended by the superintendent. We chose to, of the two options, we chose to do a hybrid learning. We did not couch that in terms of a motion to approve following the CDC guidelines, whatever they say. So a motion to say we're going to, change and follow the current guidelines, I just don't think that that's appropriate. We are left with a couple of choices here, it seems to me. We either make a motion to continue with the hybrid learning plan and to immediately ask or direct the superintendent and negotiating team to enter into negotiations with the teachers. In which case the teachers are going to feel like, and maybe with some reason, that we're not following the contract. Or we move to a remote learning fully as per the contract, while again directing the superintendent and the negotiating team to enter into negotiations with the union for the purpose of either entering into a new temporary agreement or altering that temporary agreement. Now, in a perfect world, if we made a motion to continue with hybrid learning, then perhaps the union would say, well, in other words, we can delay going to remote learning until we have been in the red for 3 weeks. In the meantime, that's when the negotiations take place. Maybe that would help the students not have the disruption of perhaps going to remote and then coming back. And I don't think the teachers want to disrupt our students any more than we do. But frankly, in my view, if we vote to continue with the hybrid after we are in the red for 2 weeks, then we are not acting in accordance with our temporary agreement.
Well, we can't do a motion to, well, we can, I suppose we can, but it would be nonsensical to do a motion to do what's already in the contract. It is, whatever is in the contract is already there.
Mm-hmm.
So the only motion that we could make would be to move to, and the semantics are the semantics, but the only motion I think that we can make is move to continue hybrid in accordance with the new state guidance, and then instruct the administration to immediately begin negotiations. Because I think that what you just said, Eric, is that every single person here, all of us, don't want to disrupt the students. So we want to get something decided as quickly as possible. But I don't see we certainly wouldn't do a motion to follow the contract. That doesn't make sense to me.
Well,
And
no.
that's what I was presenting, I guess, but, and it would be a shame if, as times change, we can't enter in discussions and negotiations with our unions about these changes, again, with the benefit of our students in mind, because that's what we're all here for, is the benefit of the students. So I would be concerned about following the existing memorandum, having, well, I don't know when the 2 weeks is, let's say Thursday, we're still in red, which we're likely to be, that we're gonna then go to remote, disrupt everything until we can then come back into a hybrid situation. I think we'd have lots of upset parents and students if we have to go to that situation.
From a legal standpoint, I mean, there's two lawyers here, and we could get more, I'm sure, but it seems there is a conflict between some of the stipulations which we have said. Clearly, there is one here which says, if 25% or more of employees live in communities with high risk, we will go switch to remote. Danvers is 34% of the teachers. If Danvers goes red, that automatically triggers it. So whatever we also agreed to with waiting 2 weeks to be in the red, maybe that is in conflict with this part of the contract. Because you cannot have Danvers go red and have 2 weeks in Danvers in red. That will never happen. There is no such thing as Danvers going in red for 2 weeks. If Danvers goes in red for 1 week, we automatically went to remote. So we automatically had a conflict there. So that needs to be sorted out as well. So I don't know if we will ever be able to have these two simultaneously at the same time. So this needs to get sorted out. And I absolutely agree on the language of the contract. You know, we have an obligation to honor this, but the overall good for the community and students and teachers needs to be taken as a whole. And that's why I would favor the immediate working with the DTA and other unions to be able to sort this out. That to me seems like the best way. I don't know the legal way to do it, but we do have a conflict here.
Right.
It seems to me.
Well, maybe we have to make a motion along the lines, going back to what Dave said, and so that we can then direct the administration to begin impact bargaining. I mean, I think that's the only way to do it.
Okay, but if that's all you do, if the motion is, are you suggesting that would be the only motion, Arthur?
Well, I'm suggesting you have two motions. One, to continue in hybrid, and two, and obviously I'm summarizing it, and two, to instruct the administration to negotiate, to enter into impact bargaining.
And doesn't one automatically put two into motion?
Well, it does, but I'm just saying from a formal perspective. I mean, let's face it, the bottom line here is that this particular situation is, again, I said it before, I'll say it again, it's constantly evolving. The slippery slope argument doesn't particularly carry weight, I don't think, in this particular situation where we have a pandemic, where we have constantly changing information. So it's not as though we're coming out and saying, the heck with you, we're just going in a different direction. We're doing it based upon the fact that the entity that put out the guidance to begin with is now telling us that that guidance is no longer valid as it comes to kids in school. That is what they're saying. That is specifically what they're saying. They gave us the guidance, it's their guidance, and now they're telling us that that guidance is not applicable if there is no spread in the schools. All right, that's what they're saying. So to go back and rely upon guidance that they themselves have said is no longer valid seems to me to be relatively nonsensical again, okay? So the fact is that what the facts were that surrounded our decision back then have changed substantially. All right, and so not only that, but we've also seen how the schools, to a great extent, have gone not just Danvers, but all around the state and quite frankly in the country, and it has not become what people thought it was going to be. So we have that information too. We also now know that we can follow clusters. We can see where things are. Contract tracing is much better than it used to be. We know all kinds of new things. We also know, again, what the parents have told us. Saying that, I understand what Jody says. I understand the issues that they're bringing up, but there isn't anything happening in the schools right now. So I don't know how we tell the parents, okay, there's nothing going on, and I know it's a nightmare for your kids, and it's detrimental to them, and it's causing great problems for them in their lives and everything, but we gotta close. I don't know how we do that. So I think the only way to get to the point is just to make a motion, and then we can vote on the motion. The contract still has to be negotiated, I understand that. But I think we have to make the motion, pass the motion, and go from there. So I would, to that end, I would make a motion to continue with hybrid learning based upon the current guidance from DESE, which is that even if we are in red, that we should continue with hybrid unless there is evidence of school spread.
Second.
Okay, so we have a motion and a second. Discussion? Eric?
Yeah, I mean, here's where I am. I actually think that remote learning is, the hybrid, while I don't know how well it works educationally or for the teachers, because I think beyond the whole COVID piece, there are a lot of difficulties with what's happening. But putting that aside, I would normally have voted to continue with the hybrid learning. I think I am mindful of what the parents are talking about. I am mindful of the impact on children, and but I think we have a contract which we have to honor. We agree to it. It's clear enough in its terms about the number of employees living in the community. Everybody had a chance to talk about that clause, and whether we liked it, didn't like it, it could have been negotiated. Right now, I think we have a contract that we, in good faith, have to follow. Now, so I've got to vote no on this motion, just on that basis. I actually think, from a safety standpoint, the hybrid could continue to work. The spread's been low. If in fact this motion passes so that we decide to continue with the hybrid, we should be at the table tomorrow with the union to begin talking this, because in essence, what we are saying is, yeah, we're going to ignore this clause in the contract, we're going to stay hybrid, and by the way, then we'll sit down and talk with you. And I'm just not comfortable with that. So I am going to vote no, again, only because of what I see in this contract as binding on us.
Jeff?
I don't see it as binding because of the conflicts that we discussed before. We voted for two separate measures which are in conflict. This is very clear. The other measures that we voted on and approved are in conflict with this. I still don't know the legal ramifications of doing one over another. So until I get some perspective on that, everything else has to weigh as to what we have to do in good faith. Now, I completely understand where the teachers and other unions are coming from on this. We could make an argument and say we're going to do hybrid for a while until something else comes up. And then from a teacher's perspective, they could say, well, okay, you keep moving the bar further and further. Well, it's red, but you said 15. Well, now it's 20, now it's 35. When are we going to have something that is reasonable? So I think when we do enter into negotiations, we do need to have something that looks like and takes this into account. I don't know what that looks like, but I definitely don't like certain hard metrics, which the definitions keep changing. And this is why I asked you before about the definition of red. It would not surprise me if the definition of red has changed or will change in the next 2 weeks. So putting this sort of language in here is a concern. Now, as far as the motion, there was a part of it, Arthur, I think you mentioned, which is we will keep going unless there is school spread. I don't know what that means. So I think we need some sort of clinical definition in this motion that would have that, because otherwise we are going to be hybrid until this committee votes not to be hybrid again. That could be tomorrow, that could be a month, that could be 2 months. So if that is the motion, I would like some sort of clarifying comments that allow that to be part of the motion as well.
Well, my motion is based on the guidance. we can all come up with whatever we want to say about that, but I think that can be part of the bargaining.
And do we know from the guidance, is there any language around school spread or specific information in that guidance? I'm guessing not.
It's what we put in your packet for you.
Okay.
That's one of the reasons why I said we should probably be meeting every couple of weeks.
Yep.
So that we can continue to reassess everything that's going on.
Absolutely.
I mean, I want these kids in school, unless something happens that they shouldn't be in school, right? I mean, I get that, but I just don't see that yet. And you know, I agree, a couple of things. I agree with Eric's statement that we should be negotiating immediately, because, again, number one, that's what we need to do, but number two, we need our families and our students to know what's happening as soon as possible. And I'm not necessarily, I made the motion I made because I don't know how to get to the point that we need to get to, okay? And so that's why I made the motion the way that I made it, because we have to do something to allow, to move this ball down the court, okay? And that's where I'm at as far as that's concerned. I don't agree with Eric when he says about, you know, we had the chance to negotiate certain other things back in August when we didn't know what the facts were going to be in November. Okay, so that's the thing that's different here, that we have a completely changing and evolving circumstance that is changing week by week, sometimes day by day, and so. And that's good, because most of the changes are we're getting more and more information and knowledge about how to deal with this thing. But, you know, we can only, and just like the state, and you know, Mary Beth says she's frustrated. I get that. I do, because I'm often frustrated with the state. But again, everybody's trying to do the best that they can based upon the knowledge that they have at every given time. And I think that we all want to do that, and I think that we all are trying to do that. And it's different. Again, it's different when you have we haven't had any pandemic cases in the court yet, Eric. So we don't know how they're going to interpret things. You know, so you know, we have a lot that we don't know about that. But look, I think we need to move to try to keep this hybrid going. I think we need to start negotiations immediately, and let's see what we can do. That's what I'm getting at.
Jeff, did you want to finish up? Or
I'm
you
fine.
good?
That's fine. Thank you.
Okay. Mary Beth?
I know when the district and the teachers and the unions did the MOU, it was done with the information known at that time. Things have changed, and they're changing daily, as we've said it tonight, and we're seeing it daily. And I think, going forward, yes, we negotiated, and this is what it is, but I also think at this time, knowing things that we know and seeing where we're at, I think all of us need to come together and make it work for the kids. It's about the kids. And whatever we need to do to get to that, we need to do. And again, we need to start immediately. So again, to Arthur's point, I'm not sure what the motion needs to be to get there. I guess the motion to go hybrid, and then a motion to enter into impact bargaining immediately. Because it does, even though it was in our plan back in August, things have changed, and again, it affects a lot of people in the community, and it affects a lot of just everything. So we have to figure out how to do this together as quickly and as efficiently as possible. That's it.
And I would just add that I know when the memo of understanding was done, it was done in good faith, based on the information that we had at the time. I don't think you will find 5 people in town that back the teachers more than the 5 people on the school committee. We look at our teachers as a partnership with the administration and the school committee. None of us can do this by ourselves. I think, looking at this now in detail and not being an attorney, I think this memo of understanding was not that well written. And I don't know who put it together, but To Jeff's point, we would have been remote already because we would have been at 25% residents a while ago. So, information has changed, the guidance has changed. As I mentioned before, we've been consistent following CDC and DESE guidance, so I think we need to move forward, and it's a lousy situation for everyone to be in. Again, we've never been in a pandemic before, so we don't know how to do this. Everyone is trying to do the best that they can. Who knows if we're doing it right? We'll never know, just like parenting. You don't know if you're doing it right until they grow up and hopefully are productive members of society. Hopefully, we're making the right decisions here on behalf of the Danvers Public School System, because that's all we can do, is do what we think is best at this time. So if there's no other discussion, we'll look for a vote on Arthur's motion, which is to remain in the hybrid mode following the new DESE guidance surrounding when a district would move out of their current mode. Is that correct? Rewording of your motion?
Sounds good to me.
Okay. All those in favor? Aye.
Aye.
Opposed?
No.
Okay, the motion carries. And I don't know, you attorneys, please tell me, do we need a motion to instruct the administrative team to enter into impact bargaining immediately related to this motion and following DESE's new guidance regarding schools when they're in a red zone?
I don't know whether we need it, but I want to make it anyway because,
Great.
a couple of reasons. Because I want to make clear that we want to get this done immediately. Number two, I want to make clear that there is a contract so that was signed back in August, and so that we need to deal with that. And I just want it clear that we understand that negotiations do have to happen. So to that end, and again, I go back and say that this is the way I know how to get to where we need to go. So to that end, I would make a motion to instruct the administration to immediately engage in impact bargaining to further the situation with the DTA relative to the changes that have occurred in the information that we know.
Second.
Okay, we have a motion and a second. Discussion regarding this motion. Eric?
No, I'm good.
Jeff?
No.
Mary Beth?
All set.
Arthur?
Nope.
I am all set as well. So all those in favor of Arthur's motion regarding instructions for immediate impact bargaining, say aye.
Aye.
Opposed? None? The motion carries. Does the administration have any questions regarding what we need to have done?
We're all set, thank you. We're ready to go.
Right. I believe that was the only item on our agenda. Before we wrap up, I just wanted to thank everyone that's participated in the feedback forums that we did last week. We did both the elementary and the middle school. We have the high school coming up on Thursday. Really, really good feedback, constructive feedback from I'd say hundreds of people that attended between the two groups. And in my discussions with the administration, they're working on plans based on that feedback. Obviously, we can't implement everything and it can't be done overnight, but they're working on plans to try and implement, some of it and what that will be, and we'll have that information at our next regularly scheduled school committee meeting, which is next Monday, November 9th at 7 p.m.
Can I just ask one question?
Yes.
I don't know if we have to make any determination on this yet, but first of all, we've talked about having additional meetings. Are we going to have one before next school committee meeting?
Well,
Or
our
do we
next
not?
one is next Monday, the
Yeah,
9th.
Okay.
So if there's a need to have one, obviously, based on the impact bargaining, I think we're all perfectly willing to do that.
Or changes in circumstances. I mean, that's what I'm most concerned about, because I want to be in a position to be able to react. Jeff made a good point earlier, which is that, we may have to keep voting on what to do based upon the circumstances. If we have, if we start to see cases in the school, you know, it's gonna change my opinion as to what we need to do here. And so I don't wanna go too long without at least being able to assess, get information from Mark and know what we're dealing with. So we don't have to necessarily make a decision right now, but I just wanna throw that out there.
Okay, so why don't we leave it that our next scheduled meeting as of now will be November 9th, a week from tonight. If anything changes, either circumstances or information from the bargaining that requires us to meet prior to then, we will. We need to do 48 hours notice?
48 hours, but there is emergency language also.
There's an emergency.
Okay,
provision.
so technically 48 hours, but we can do it in less than that if need be. And then next Monday night, at our meeting, we can talk about it again and look to schedule maybe a meeting towards the end of November before because I think our December meeting is like December 14th.
It is, yeah.
So from the 9th to the 14th, it's a long period of time in today's world.
Yep.
So maybe we add 1 or 2 meetings in between November 9th and December 14th.
Okay,
if
that's good.
everyone's in agreement.
Yep.
Anything else? Great. That is it for tonight. Good night, Danvers.
You need a
Oh,
motion to
I
adjourn.
always forget my motion to adjourn. I need a motion I used to make it, that's why I forget it.
Motion to adjourn.
Second.
Okay, so we have a motion to adjourn in a second. All those in favor?
Aye.
Aye. Motion passes. Good night, Danvers.
Thank you.
Thank you, Eric.